Lunch and for Instill Wellness for being our sponsor today. Instill is a wonderful facility just a mile down the road from us on Forest Drive. They offer child, adolescent, and adult psychotherapy, heart math, acupuncture, sound therapy, medicupping, Reiki, reflexology, and many other integrative modalities. We have some of their practitioners today with us. They are devoted to supporting and guiding clients on their individual journey to health and wellness. Thank you so much for your participation and all that you offer to the community. There's additional information about Instill in your packets today. Today, we're taking the time to talk about cultivating resilience and coping through a pandemic. This is one topic that everyone in the room actually has some experience with. COVID was a source of unexpected stress and adversity for many people. Since the pandemic hit in early 2020, we've muddled through and collectively weathered a storm that we're still unsure when it will end. The devastating toll of the pandemic has underscored the critical importance of connecting what science is telling us to the lived experiences of people and communities. Neuroscientists, mental health practitioners, and psychologists, like we have in the room today, study the long and short-term effects of stress and traumatic experiences on the brain, the body, and our psyche. The deleterious effects of extreme stress and trauma exposure are well documented. We know that when stress exposure is intense, chronic, uncontrollable, and overwhelming, it can give rise to or exacerbate burnout, depression, anxiety, and numerous physical conditions such as inflammatory, cardiovascular, and other medical illness. What is of increasing importance to the aforementioned medical community is resilience. Just a quick Google search for the word resilience will leave you reading for weeks. A greater understanding of how to cultivate resilience is of great relevance today. The content is fascinating, and I will leave it to our panelists to provide these details. On that note, it is my great pleasure to introduce our guest today. On the panel is Tanya Schmaderer. She's a social worker and psychotherapist. She's a member of the Ohio State University's Women's Behavioral Health Team, where she provides behavioral health services for women across the reproductive cycle. Tanya will soon be operating out of our building upstairs and providing many services, which she'll talk about today. Dr. Michael Stauber is a clinical assistant professor of psychiatry. His clinical interests include treating patients with mood disorders, including depression and bipolar disorder, as well as anxiety disorders and trauma-related disorders. He is also interested in psychodynamic psychotherapy, education, and telehealth. Dr. Stauber will also be working upstairs in our building beginning in January. Dr. Anthony King is a neuroscientist and licensed psychologist and psychotherapist. He's an associate professor in the Department of Psychiatry and Behavioral Health at OSU and the director of the Center for Resilience. He is committed to clinical and translational research aimed at elucidating the social, psychological, neural, and genomic factors, underlying risk and resilience for mental health and the relationships of social, emotional, and mental health to physical health. Dr. King has an MS, a Master of Science in Clinical Psychology, a PhD in Molecular and Integrative Physiology, and a PhD in Clinical Psychology. He is the author and co-author of over 60 peer-reviewed publications in high-impact journals, and his research has been funded by the National Institute of Mental Health, the National Center for Complementary and Integrative Health, and the National Science Foundation, as well as the U.S. Department of Defense and the Mind and Life Institute. Thank you, all three of you, so much for being here today. Thank you. I want to just share, since Tanya and Dr. Stauber will be moving into the building in January of next year as part of our OSU mental and behavioral health team, could you first just share a little bit about what your specific focus areas are and the work you do every day, essentially what services you'll be providing in the building? You can start, either one.
Yeah, I can start. So thanks for the wonderful introduction, Angela. Like you mentioned, my name is Dr. Mike Stauber. I'm a psychiatrist, and my specific interests in treating those with mental health disorders include evaluating people and treating them for disorders, including depressive disorders, including major depressive disorder, other forms of depression, various forms of anxiety related disorders, including generalized anxiety disorder, as well as different trauma and other stressor related disorders like PTSD or post-traumatic stress disorder. Also, as Angela mentioned, I do have some interests in psychodynamic psychotherapy, which is a specific form of psychotherapy. Also, I am interested in education primarily for psychiatry residents. That's something that I'm hoping to get started in the years to come, working at Ohio State. And then lastly, telehealth, which I had some experience with as well, as I imagine you both had as well.
Yeah,
Thank you.
And I'm Tanya Schmaderer, as she said earlier. And I am the psychotherapist here with our Women's Behavioral Health. So I work primarily with women who are either pregnant or postpartum, also dealing with infertility, miscarriage, and other things along the reproductive life cycle. Working on similar disorders. You can't, okay, try to make it a little better, sorry. Similar disorders, as he said, so primarily depression, anxiety, some post-traumatic stress disorder, those types of disorders. I'm treating those again during pregnancy and postpartum primarily. I work with lots of parents of small children as well. So that's sort of what I do, what I'll be doing here as well.
Thank you. Dr. King, could you share a little bit about yourself and your focus areas?
Sure, very happy to. Thank you. And it's such a delight to be here. And thank you for the over-generous introduction. I appreciate that. So I'm actually fairly new here. I've been in, I started at the university, at the Ohio State University this summer, and I'm working closely with a number of folks, Luan Fan and Craig Bryan and Stephanie Gurka, with a strong interest in building up a clinical research program, trying to really understand what are the effects of adversity, what are the effects of stress, what are the effects of trauma on people's brains and nervous systems, and in particular, how can we use that information, sort of the risk information, to develop, new empirically supported interventions and prevention programs. But we're also, in particular, very strongly interested in what we call resilience. And as Angela said, I'm sort of the director now of something called the Center for Resilience. It's not really here yet; it doesn't exist quite, except in name, but it will be here. And so our plan is, well, I should say that I'm from, I don't know if there's any football fans here, so I'll try to be careful. I'm actually from that university, what did they say, up north? I think to the north, yes. And I worked at the Ann Arbor VA for a number of years, working with primarily combat veterans veterans primarily with combat PTSD, but also associated problems, working as a psychotherapist and introducing some mind-body interventions, which has been a primary interest of my own for at least 10 years now. I think we started our first groups in 2005, so it's almost 15 years now. So with very strong interest, as I know many of us here have, in how the nervous system and the immune system sort of feeds back and has a complex interplay with the brain and with our mind, and how different things like the wonderful programs I'm hearing are here, such as yoga and mind-body interventions and Tai Chi and meditation. How can these potentially have effects to stabilize nervous systems and to stabilize minds, and to also to be actively helpful for coping both with the acute effects of depression, loss, and post-traumatic stress disorder, or as well as building resilience, so that when we are exposed to chronic stress, adversity, or trauma, that we have basically some skills to use. So in short, I'm going to be doing hopefully, well, I actually have 2 research projects that are going on now, and primarily in Franklin County. These involve something called mindfulness-based cognitive therapy, and our comparison intervention is called progressive muscular relaxation. These are both really nice mind-body interventions. We particularly, and we're offering this for people in the community who currently have experienced trauma and have post-traumatic stress disorder, and we'll also be working with veteran populations and first responders as well. So should have just got IRB approval. For those of you who know what that means, it's a little bit of an arduous thing. It took a couple months to get.
Wow, that's
So,
wonderful.
So I guess that's my story.
Thank you. And feel free, if you're speaking and you want to take your mask off, you can, and put
Oh.
it back off, whatever you feel comfortable with, just so you know. So here we are in the midst of a global pandemic. We're all trying to figure out how to cope. There's tremendous uncertainty. For some, there's immense fear. There's death and disease, lack of clarity, no end in sight, constant flux. The terms pandemic fatigue and pandemic flux syndrome have popped up. So could you tell us, what does 18 months of acute crisis do to the nervous system? We're feeling exhausted, withdrawn, powerless, with anxiety and depression. We're shutting down. Are some people at surge capacity? Can you describe this and provide some insight into what people are feeling and why? Anyone?
Well, I can start to say, but maybe start off by saying that we're not alone. Like an important study by the CDC found that the rates of depression, anxiety were increased between 200 and 300%, meaning like 2 to 4, actually 200 to 400%. So there's been really a very large uptick. And this was in June of 2020. Things have actually gone down a little bit. There's been about a decrease, according to epidemiology, of about 20%, which still leaves us, at very highly elevated levels of symptoms of depression and anxiety. So, yeah, I think we're all feeling it in different ways. I mean, obviously, people have different lived experiences, particularly for people who have COVID in the family or have suffered illness themselves. I mean, it's huge. And I have a number of folks in my life. I have not contracted it myself, thank goodness, but know people. And but most of us are experiencing simply the disruption of our schedules and sort of how we do work, how we live our lives. So it looks like the people who are at greatest risk are people who have previously been sought treatment for a psychological or psychiatric disorder. So people with depression and anxiety, maybe not unexpected. The other people who are, the other groups who are at greater risk, of course, are essential workers. And the third group are people who are providing care, unpaid care, to family members. So I think recognizing what the role of family stress, what the role of job stress, and of course, previously having some depression or anxiety has really impacted. I don't remember. Yes, I'll stop there.
Dr. Stauber, when we talked, you spoke a little bit about people being demoralized. Can you share a little bit about what you're seeing as well?
Yeah, of course. As far as that term demoralize and demoralization, I like to think of it as referring to a change in one's lifestyle that just takes them away from what they were used to and struggling to figure out, how do I cope with this given stressor? How do I cope with this change? And how much it's making them feel different from how they used to feel. I think people, especially with what we're dealing with currently, and what we've dealt with for the past year and a half, like what was mentioned, is that some of those who are at most risk for doing much worse are those who have already been previously diagnosed with a mental health disorder. And as much as that's true, there's also people who are struggling, for the first time with this issue. And how does one figure out, are they in need of additional care or new care for the first time? Seeing a psychiatrist, seeing a psychotherapist, or a counselor, and talking about feeling demoralized. Perhaps a couple ways of gauging that sensation is to question how your life has changed in perhaps 3 different ways. And these three things I'm discussing are sleep, diet, and daily physical activity. Those 3 things, they're fairly simple things to keep in mind, and they can be things that you can monitor on a daily basis to see, are these things changing in my life for the worse right now? And if they're changing, what kind of things can I do to get them back in line and have myself function with a sound mind and get back to one's previous level of activity. So those are 3 things to kind of keep in mind, and I can touch on them more in a couple of minutes.
Great. Anything to add, Tonya?
Just to add that we've talked about how many people have experiencing COVID or family members who have had it. But I think it's also important to recognize that even if that is not something that has actually touched your life or your family's life, it's the constant ongoing stress of it might, or all of the other effects that we are experiencing, both personally, socially, and even economically. It's kind of the ongoing chronic stress that those things might affect us, let alone an illness that can be pretty scary. So I think that that's an important piece to really recognize, that many of us are experiencing the stress and this decrease that maybe in resilience. And even if we haven't had that effect, it's because we have all of these other things we're worried about because of the ongoing pandemic.
Thank you. Oh, go ahead.
Well, I was also going to say, as Dr. Stauber said, that the disruption of our lives, one of the things, and how that affects sleep and daily activity. One thing that I personally found, and that I also strongly recommend to all the patients I work with, is getting outside, actually, and trying to have some semblance of for people who are home workers, trying to keep some routine. It's very tempting to kind of stay up late at night or whatever, but you try to keep some routine and keep up with exercise and get outside. For people who are essential workers, I think also, the stress there is very often, as Tanya was saying, in the form of a very real and very realistic worry about, may I contract? So they're obviously, keeping, using your personal protective equipment as much as possible, but also really looking at diet, looking at how much alcohol and caffeine you're ingesting. I'm guilty of the caffeine myself quite a bit, but just noticing it and keeping, going outside.
Dr. Stauber, you mentioned that as well. And what you're seeing with your clients is the increased use of alcohol and cannabis use. And you talked a little bit about that. Could you share that as well with the group?
Yeah, of course. Oftentimes people will talk about using various substances. I mean, talk about alcohol and cannabis, using them for self-medication, as people will call it. And I mean, that's right. They act on your brain, and alcohol can have some anxiety reducing properties. Sometimes cannabis can do the same thing, can make yourself feel more calm. And these all sound like good things. But the issue with both of these substances and other ones as well is that it's highly unregulated compared to like medications like antidepressants, anxiolytics, mood stabilizers, medications used for sleep as well. So it becomes extraordinarily difficult to modulate how much of an effect these substances are having on your brain, and further symptoms and also side effects. And the problem in particular with illicit substances is they can have a tolerating and like depending kind of effect to them. And in other words, that means the more and more you use, the more and more you need. And then on the flip side of that, an initial effect which may be helpful with anxiety can then in turn lead to increases in anxiety. One thing to comment on specifically, just regarding like alcohol and cannabis use, is that even though they can make you a little bit sleepy at first, they've been shown to lead to overall poorer quality of sleep. And that's one thing that kind of segues into what I wanted to discuss about sleep hygiene. I'm not sure if anyone here has ever heard of a concept called sleep hygiene before, and I can get into more details about it. But just since we're talking about substance use, alcohol in particular has been shown to, in the later stages of sleep, to make the sleep itself less restorative, less productive. And so even though it may seem like getting to sleep earlier on time after I had this drink, the sleep you're actually having later on in your sleep cycle, 2/3 approximately of the way into it, is less restorative. So it may be like a short-term gain, long-term loss kind of a situation, especially with alcohol in particular.
Would you say that the pandemic has made conversations about mental health more common and perhaps less stigmatized?
That's hard to say. You know, I think people are definitely, you know, feeling the effects of it, and they're questioning whether or not they could benefit from seeing somebody. But you know, it's hard to see. You know, it's hard to say for sure, because you know, I see those people, but then the people who do feel stigmatized, then I don't see. Perhaps I may see like their relatives, and commenting on, you know, my child's having a very difficult time, but they don't want to come see somebody. So I think for some people, yes. For some people who are kind of new to mental health, it may be kind of unknown. But I do think that, I mean, at the very least, I can say that there are like the wait lists for coming in to seeing a mental health care provider are quite long, and they've been that way for like throughout the pandemic, and they continue to be that way. So I think if that's any sign to people considering, you know, getting treatment now, like a sign of the stigma perhaps being affected for the better, then yes, I'm hopeful.
And what about the increased use of telehealth services? Is this expanding your audience and increasing access?
Yeah, so I was going to say, you anticipated exactly what I was going to say, is that one of the maybe potential silver linings, so to speak, or not really silver lining, but one positive thing that has happened is that we all went pretty much overnight to using much more telehealth. I mean, I was actually still at the University of Michigan. I had did about 5%. The expectation was to do 5% of your clinical service in telehealth. I quickly went to 99%. Basically, I made a couple of in-person. And okay, telehealth has its problems for sure, but it has a lot of advantages. And it really, I think, helps people with access. It helps with even just the simple things of getting parking, of the stress and anxiety of walking into, you know, a room full of people for the first time, or for any time. And a lot of patients that I work with has found this very helpful. And the other thing, I think, while I completely agree with Dr. Stauber, sort of was really mixed bag of people's worry about social perception and about stigma. But I do think we can all talk about stress, and we can all sort of, that has been there's been quite a bit of raised awareness about the role of stress in our lives, how that affects us, how it affects our performance, our feelings, our moods. So I do think that there is an increase in the conversation, which hopefully will both of these things. I mean, I think it's very possible that you know, that the effect that we've seen on telemental health will continue. We'll probably continue offering quite a bit more service than before.
Yeah, I was just going to sort of echo what you said, that certainly the telehealth transformation from a behavioral health standpoint has transformed how well patients are able to access the services, especially my population, both pregnant and parenting parents of small infants and small children who have been fearful of leaving their homes for their children's safety, have really been able to make appointments much more regularly than prior. I have many more patients who continue with treatment after the first couple of sessions, whereas before it would serve as too much of a barrier to continue to come for all of the reasons he mentioned, not only just anxiety of going somewhere, but taking the time out of their workday, taking the time for childcare, and all of those things. So now I have many more patients who are able to just continue and actually get the treatment that they need, because they can do it from their couch while their children are watching TV or running around, or they can do it from their car, or they can do it at work. They don't have to leave and take all of that time. They can just do it on a break at work, which has its challenges as well. But before, I was doing sessions in a small room with toddlers running around. So at least they can be in their own space. So certainly I think it's helped with a lot of barriers, so people can continue.
Right, and I think also one thing that I've noticed, and I think is a trend, is that of course we know that there's a lot of inequities, both in health outcomes as well as healthcare opportunities. There's many barriers, particularly for people who are low income and who are essential workers. I mean, it's very difficult. In addition to women who are in pregnancy and others, and people with chronic illness, many often we don't recognize how difficult it is for people to come in. And to take time off work, to spend the money for parking, to go across town. So I do think that the telebehavioral health and telehealth in general, I'm really hopeful will be able to continue to decrease barriers and to make more behavioral health available.
Well, and you read my mind, Dr. King, because that was my next point, just about health equity, that it's extremely important to point out that there is clear evidence of the health disparities related to COVID. That is, COVID affected different groups very differently along the lines of race, income, and socioeconomic status. I know personally here in the community, working with food pantry clients, when their kids were home from school for extended periods of time, they were driving 3, 4, 5, 6 kids around Uber drivers because that was their job, and the kids weren't getting schooling. They were going with mom and dad to deliver food because that's how they paid the rent. So I think it's extremely important to point out that health equity, there are disparities in the rate of infection, the harshness of symptoms, the deaths, vaccine distribution, of course, job loss, hunger, and evictions have all been well documented, with people of color and other marginalized communities carrying disproportionately higher burdens. So I just think it's extremely important for us to know, recognize, and acknowledge that within this conversation. Could you talk, Dr. King, about the brain during adversity and share with us what happens?
Sure. Well, that is a topic close to my heart and my mind. And I think it's important, first of all, to think about different kinds of adversity and how they may potentially affect the brain and the nervous system in similar ways and in different ways. One top form being trauma. And trauma is of course, is an English word that has a lot of different meanings for people, but according to the NIH and the APA, the American Psychiatric Association, so general medical definition of trauma is a direct threat to life that's perceived, or a direct threat to, or a violation of a person's physical integrity, such as sexual assault. So traumas are actually quite common. I think was not really recognized probably until about 15, 20 years ago with the famous Fellini study. And Fellini, I think it was 98, so about 23 years ago, that childhood adversity and childhood trauma is much more common than was really appreciated. I think there's been a lot of stigma and sort of brushing things under the rug, but there's incidents of different sorts of childhood adversities, somewhere around 25% if you add it up. And the more types of childhood adversity that people have, the stronger the effect on their brains and nervous systems. So the forms of adversity that we see, or that epidemiology sees as well, are forms of childhood maltreatment, as well as neglect, and frankly poverty. Poverty is very often associated with a lot of chronic stressors in the form of neighborhood crime and danger, the form of sort of dilapidated structures, etc. All of these things are found to have subtle or less subtle, sort of gross effects on the brain. In particular, for childhood maltreatment and as well as adult trauma, one of the signature things that appears to happen across the board is an increase in the activity and the connectivity of systems in the brain that process threat. So many of us have heard of a structure called the amygdala, which is sometimes called the fear center. It's not really a fear center, but it is a center for what's called salience, for detecting important things in your environment, registering them, moving toward them. There is networks in the brain, in particular involving the amygdala, the dorsal anterior cingulate, which is sort of a deep structure, and the insula, which is two areas sort of by our ears, which are common both to detection of threat and to feeling of pain, which is interesting. So people who have experienced both childhood and adult trauma, as well as in slightly different ways, chronic stress, meaning chronically having either demands placed upon them that are very difficult to meet, which often happens with poverty, or which happens when caring for somebody with Alzheimer's, for example, or other sorts of chronic stressors. The threat detection circuitry starts to become more active and more directed toward the environment. So there's a feeling of noticing potential threats in the environment more. At the same time, a number of circuits in the brain which really participate in regulating threat and actually signaling safety, particularly in the frontal cortex, the dorsolateral prefrontal cortex, and the medial frontal cortex, so right between the eyes, their interaction with the threat system starts to decrease. So normally, if the classic example is walking out in the woods and you see a long thing in the grass, and your salience system immediately thinks it's a snake, right? And you get a startle. As you look at it closer, and then your heart rate increases, and all these classic threat-related processing, your cortisol level goes up, your adrenaline goes up. As you look at it closer, you notice, oh, it's actually not a snake, it's a piece of rope. Okay. Now, normally what happens, or there's a diversity, a variation in how sensitive the threat detection system is, and also how strong or effective the emotional regulation and safety signaling is. So normally there's always an interplay, and this is crucial for survival. We need to be attentive to threats in the environment, but we also need to know when it's a false alarm, and we can then remove, continue with our. So safety signaling goes down, emotional regulation goes down, the adrenaline system gets increased. So in work that I did with Gary Evans at Columbia, or it's I'm spacing the name of that. So Cornell, sorry. He had a birth cohort, and we found an amazing thing is that for children who had grown up in poverty in upstate New York compared to people in median income families, the amygdala became more sensitive to angry faces and less sensitive to happy faces. And the opposite was true with people in median and higher income. Their amygdala was more registering happy faces. So it suggests potentially a lifelong imprinting of people's view of the world. Is the world a place where we can reach out and network and get affiliation and support? Or is it a place where there's danger?
I want to hear, before I ask you the follow-up question, your definition of resilience.
Thank you. So I think that's also crucial. Resilience, in a sense, has two parts as well. Resilience talks about the interaction of an organism or a person with adversity. So adversity of the types we've talked about, there's a lot of them. There's loss, so loss of social status, loss of income, loss of family members through death or through separation. And there's trauma, there's fear of repeated trauma, and there's other sorts of adversity. So resilience refers to the ability or the capacity, in a sense, to be able to, after experience of a trauma or a loss or other sorts of adversity, to be able to function and to have a lack of negative, this is very technical, but the way we operationalize it in our ongoing studies is sort of a lack of negative outcomes, meaning symptoms of depression, anxiety, etc., and the presence of positive outcomes, such as function, such as also self-report. So and that's a very simplistic in a sense, but it's actually very profound at the same time. So resilience is about the ability in the presence of previous trauma or adversity, the presence of ongoing stress and adversity, to be able to function well and to be able to have a nervous system which is sort of tuned to be able to function and to cope.
Thank you. So in doing a little bit of research, I came across a really interesting study by the National Institutes of Health. The article was called Understanding Resilience, and it talks, just as you mentioned, about the children with a history of maltreatment showing lower resilient functioning than those without the maltreatment. And of course, children with war exposure and related traumatic experiences, such as experiencing bombing, forced displacement of refugees, child soldiers, etc., of course, showed increased risk for PTSD, as well as other medical conditions such as cardiovascular diseases and others in adulthood. However, besides children that we just mentioned experiencing this abuse and life-threatening environment, researchers have newly identified a group of children at risk, and that is risk of youth from affluent families who may face higher risk of adjustment problems such as substance abuse, depression, and anxiety. And the study was fascinating about how the risk for children of affluent families compares in many respects to this maltreatment. Could you talk at all about that?
Well, as you said, it's a new study. It's really fascinating. But I think the bottom line is that adversity comes in many flavors, and challenges come in many flavors. I'm very interested, and we think a lot about marginalization. And in marginalization, we mainly think about it, particularly in the United States, of people with low income and people who have experienced racial discrimination of various forms. This is really a profound and old problem. So, but I think people can be marginalized in many different ways and feel marginalized. I think how we feel about our surroundings, maybe ironically, is very powerfully predicting how we then behave and how our nervous system is affected. So on one hand, that's a problem. So suggesting that having feelings of marginalization can predict negative outcomes, but that's also an opening for potential intervention and prevention, as finding ways to connect with resources, and that's not but also recognizing that the things like exposure to war, but particularly exposure to childhood maltreatment is common in this country. Racial discrimination is common in this country. Other forms of marginalization are common. So I think it's incumbent upon, so it's interesting. So in work that I do, it's I strive hard, in a sense, not to do things that seem like blaming the victim, because these are real things. But at the same time, there are positive things that people experiencing marginalization and trauma and adversity can do to help themselves.
Is resilience, would you say, determined by the individual, or is it at the community and social level? And can you describe some of the factors in resilience?
Wow, yes. So that's brilliant. So it is. I mean, I think that's a really important point, that that resilience is not just some set of traits that somebody has from birth, or think about, there's resilient people and non-resilient people. I mean, we do that in research studies because a way of sort of being able to understand the processes. But I really look at resilience as a process of adaptation, and communities are hugely important in that. And they can both positively and negatively impact how resilient people are. And I think social connectedness, I think, is among the most important things. And negative things can be things like peer pressure toward drug use, or even sort of despair over the state of things. But I think community organizations are hugely important. One thing that we know about childhood development is that one of the biggest factors, so I've said that childhood maltreatment is associated with very large increases in adult psychopathology and cardiovascular, and actually every kind of morbidity. The one of the social factors that stands out is having the presence of one or more adults outside the family and the life of the child that cared about them, that they could trust. So I think social connectedness is huge.
If I could just comment on a bit of the community definitions and cultural influences on resilience. Perhaps a certain person is considered resilient if they encounter a stressor or a traumatic experience of some sort, and they continue on going with work, and perhaps nothing really seems to be amiss. But I think it's important to recognize that what resilience is not is merely just hiding one's feelings, emotions, any kind of symptoms they have, because those things are often hidden a lot more easily than one may think, and someone may be struggling much more internally than what comes off from other people externally. So they may be seen as resilient, but perhaps they are struggling internally.
Would you comment? Did you say, Tanya?
I was just agreeing exactly with what you're saying. I think it's an important factor to, as we're thinking about looking for in ourselves, are we struggling with problems with this chronic stress, and the resilience is knowing that you can be resilient and show what's happening, and as well with your family, and being open about those things is actually how you can increase your resilience, versus hiding it, and trying to be too strong, right? I think many times that's the thing. We try to be strong. We try to be strong for our family. We try to be strong for everybody else, and that certainly can decrease our ability to be resilient.
What about the role of self-efficacy and self-esteem in building resilience? You can pass, and I can go to the next.
Sometimes I'll think about I think one of my mentors in my residency training had mentioned this. that sometimes it's okay to be selfish, or like be selfish for yourself. And there's, I use the word selfish not to say, be greedy or something like that.
Will you hold your mic just a little
Oh, sure,
Yep.
sure. So sorry, just to repeat that. Back in my residency training, one of my mentors said you'd say a comment that it's okay to be selfish, or be selfish for yourself sometimes. And I don't use the word selfish to say that, put yourself in front of others or be greedy or something like that, but recognize perhaps when you aren't putting your your fundamental needs at the forefront. And if you find those things, like what I mentioned earlier about like if you're making huge sacrifices in things like your sleep and things like your diet and things like daily physical activity, then at that point, perhaps think about this this comment to put yourself forward if you need it. I mean, obviously, if you have certain obligations for others, don't forego those. But perhaps sometimes it can be helpful to think of it's okay to be selfish.
Yeah, so self-efficacy is a sort of a fancy 50-cent word, but it refers to the ability of a person to believe that they can have an effect on their environment. They can do, when they make an effort, something that they can actually achieve something. So I think it's huge, actually. Again, it has to do with our mental and emotional relationship to our environment. And feeling like if we keep trying and nothing ever changes, we can't do anything. This can actually lead to a sense of another fancy word called learned helplessness, sort of feeling that we really can't do much in our life. And this can lead to a lot of internalizing problems and stress and increasing of the stress response systems. What's interesting about it is it's an internal factor. I do think that things like social emotional learning programs that are done in schools, I think help people, and I think adults too. We can start to sort of recognize the types of habits and patterns of thoughts that we have about ourselves and about the world. This is like I call it plain vanilla CBT, cognitive behavioral therapy. I think is really helpful for people who don't have depression and who don't have anxiety, who are stressed, to be able to kind of look at the way that they perceive their surroundings, look at the way they perceive themselves. Because yes, so self-efficacy and self-esteem are two of the factors that always show in sort of epidemiological research on
you spoke about the social emotional learning in schools. Can you share a little bit about what is that? What does that mean?
Sure. I should say, first of all, I'm not an expert on this, but I'm a fan. Because it translates. So I really am. I mean, I don't work a lot with kids. I did some of my training. I work mainly with adolescents and actually and with elders too, with chronic depression and chronic PTSD. But social emotional learning is sort of like is a set of practices which are national, actually internationally, recognizing that in addition to teaching kids about crucially important, content or subject matter of literature and writing skills and cognitive skills and computational skills and math and numeracy and literacy, teaching people about their own bodies and about their own minds and about their emotions is also important. And teaching people about social factors of how, what are the types of ways that we can interact socially to be assertive in getting what we want without, being aggressive. So I'm not an expert on it, but I have, and I'm sorry, there's not remembering the very specifics of it. Maybe somebody here remembers. So there's 6 different principles, and they're about learning, cognitive emotional regulation, recognizing your own emotions, recognizing your interactions with others, and there's 3 more.
No, I think the layman's is good for me and all of us for sure. We talked a little bit about bottling resiliency. Of course, the whole wide world wants it in a pill or bottle format. Of course, we can't do that. But maybe you could share what the most important determinants or drivers of resilience might be.
Well, that's what we all want to know.
I have a list. I can go through and ask.
Sure. So, well, I think part of it is the social connectedness is really big. And as Tanya and Dr. Stauber were saying, sort of recognizing your own emotions and getting support. I mean, I think this is huge. It's simple, but I think it's a big driver. There are a number of, so social, I think that social and, family and community support, institutional support from schools or from workplaces, I think is huge. Friendships. And then there's a number of personal level things. And these are things that I say that I think are quite easy to get into ruts and to have negative, either whether it's in the form of self-criticism or whether it's in the form of sort of worry and anxiety about dangers in the world that may be realistic, may be a little bit exaggerated, which have a continuous effect of stress. So I think I really think it is things like, well, again, plain vanilla cognitive behavioral therapy, ways of emotional regulation, I think is one of the big ones. You have a list, so that's good.
Yes or no? Role of gratitude and hope. Does that play a role at all?
Yes, for sure. So and gratitude, I think, is related to this idea. Gratitude and hope is again related to the idea of how we see ourselves in our world. And very often, our brains are wired to privilege and to make more important threat. Right? And it's important because we need to first attend to threat and keep safe. But what that does, an effect of that though, is to kind of forget about all the good things. Mm-hmm. So I think gratitude is one way to purposely, there's gratitude exercises, but sort of recognizing, in addition to the threats, recognizing those sources of support, sources of reward that we do have in our families, for example.
I also think that hope is particularly important. I mean, especially with like the pandemic and how long and drawn out things have been. And it's important to, when I think about hope, I think about looking forward to a specific kind of goal, or even just like a non-specific hope that things will improve. And it's important to, have that reassurance and have that feeling that things are going to get better and things are going to improve as long as I'm trying to make active changes towards whatever specific goal that is. Mm-hmm. So I think that can, certainly be reassuring and add towards one's resilience.
Mm-hmm. We talked a lot about, especially with the social emotional learning, that recognizing our emotions and social emotional learning isn't a thing that was as implemented when many of us were younger. It's a newer thing. And so what I usually say to my patients is, you weren't taught how to recognize your emotions. You weren't taught that. Hopefully now we're going to teach kids, and I won't have as much people to come see me. But we weren't taught that. But I do think that when we think about recognizing some emotions, to echo what Dr. King said, is that we're really good at recognizing the emotion of guilt. We're really good at being guilty for things and making ourselves feel guilty. But it's that recognizing being proud, feeling proud, or recognizing our accomplishments, we're not so good at. We don't do that as often, nearly as we do with feeling guilty about things or blaming ourselves for things. And so the shift in that, practicing more, recognizing our accomplishments and recognizing things that we can be proud of or things that we have endured or are enduring, really can help build resilience. Can make a big difference in how we're feeling. I work with many moms, of course, who have mom guilt. That's a real common phenomenon. And often one of the most helpful things is just taking a few minutes at the end of the day to be proud of what they've done, to actually realize they've accomplished something. And that can make a big difference, because we can get really down on ourselves for all the things we don't do or aren't doing correctly.
And that builds the self-efficacy that you were talking about.
So mom guilt's a real thing.
Oh, it's real. It's real. And I think another interesting sort of piece of this, especially when we're thinking about guilt, when we're thinking about the pandemic specifically, we've talked a lot about the adversity and the stressors that have come along with it. And for many people and in many different situations, there have been a lot of good things. I mean, we mentioned telehealth as a silver lining, but there have been a lot of good things that have happened for many people as well. I've personally enjoyed working from home and having that privilege, right? There are many things that many people have privileged or benefited. And I think that can play into some of the guilt as well. If you haven't been affected from a health standpoint, maybe you've actually had lots of good things happen from this. That can play into causing more stress, actually, this sort of guilt, almost like a survivor's guilt that we may not recognize. So you may be experiencing this sort of chronic stress of things are going well for you and you're not really quite sure if you should feel good about that. And so I think that's another one that we don't always think about, but can be at play.
It's interesting. We talked a little bit about learning how to manage stress, and it almost feels like it's a muscle, right? We want to give our kids the opportunities to manage the stress muscle while avoiding exposure to unmanageable stress, providing them opportunities to embrace and conquer life's challenges, essentially to acquire stress inoculation. Could you talk a little bit about that? I think we all want to do that for ourselves and for our kids.
I think you hit on something really important, which I forgot to mention, is that stress is actually not universally bad. There's many forms of good stress. You even have a word for it, eustress, E-U-S-T-R-E-S-S. There's a famous, from Psychology 101, you may have seen this sort of Yerkes-Dodd inverted U-shaped curve, right? We need a little bit of stress to get us moving in the morning. If we don't have any stress at all, we become couch potatoes and, sort of are not moving. If we have too much stress, I mean, this was actually an insurance company that did this looking at worker performance. So, take it with a grain of, recognize the source, but stress is healthy. Just like if you think of a plant that's growing, a tomato plant that's always sort of completely scaffolded, it has no resilience. It has no ability to bounce back. So I can share with you a personal thing. My daughter really wanted, her dream was to go to the Ohio State University and be on the cheerleading team. It's one of the best cheerleading teams in the country, second to Kentucky. And she was on the team, she was getting ready and enrolled. We sort of paid tuition the whole shot. The coach cut her from the team a couple of days before. That was terrible. That was a horrible thing. She was in, took a couple of days to recover. But then I saw the magical thing that happened, and she had to go to her default school, which is U of M, and she got onto the team there and was able to to grow. So I think just on a personal level, that impressed me. But I think stressors come in all different flavors and varieties, and we need to actively, as you say, have a muscle to work with that. Mm-hmm. So it was a great analogy.
Actually, I also want to just briefly comment on the concept of stress inoculation that you mentioned. It's actually, the concept is quite similar to inoculation from a vaccine. I mean, you introduce a benign thing. I mean, in the case of a vaccine, a benign part of a virus versus stress inoculation, hopefully as benign as possible stressor, but for the sake of providing for a more robust response to something in the future, if it's like encountering that virus or encountering a more severe stressor in the future. With stress inoculation, you don't purposefully introduce stressors to people, but we're going to encounter them regardless. And when you do encounter them, to provide as much of a reassuring and supportive environment as possible to make that inoculation period as beneficial and as productive as it can be for preparing for more severe stressors in the future.
Thank you. I won't read what you wrote, Dr. King, because I'm not sure I can say all the words, but in short, you talk about teaching mindfulness to the public and your research about mindfulness and the increased capacity for volitional shifting of attention and so many other things. Can you talk about that?
Sure. So I think mindfulness is one avenue to get at some of these basic forms of emotional regulation. And it particularly strengthens the muscle of one type of emotional regulation, which is called metacognitive emotional regulation. There's many types. There's sort of different forms of relaxation, there's self-soothing, there's getting social support, and then there's ability, as we've all been sharing, to be aware of our own emotions, be aware of our own thoughts, and recognize that they are actually mental events. They're linked to real things in the world, but are actual, technically, as we experience these things, these are mental events. Emotions are mental events, thoughts are mental events. So I found mindfulness meditation as being one tool among many that I think is helpful for developing this form of metacognitive emotional regulation. And I think it's something that's generally good. It's not a panacea. It doesn't cure everything or even anything necessarily, but it can be a component of treatment of psychotherapies, and it can be a component, excuse me, of sort of general wellness and resilience training. I think it's got a couple of different, in addition, so I'm specifically talking about the cognitive part because that's what I study. I do brain imaging and look at effects on, and I also study another form of a very useful form of a mind-body intervention called progressive muscular relaxation. And I think that this is also very good. So there's two components very often of slowing down, of coming into the body, having body awareness, grounding, and sort of regulating the nervous system a bit, because we spend a lot of time, in the sympathetic, or what's called the sympathetic nervous system is the part of the nervous system that drives the fight, flight, or freeze response, which is hugely important. We need to have a good sympathetic nervous system, but we also need to have a good compensatory, relaxing, sometimes called the rest and digest response. We need to be able to feel safe. We need to be able to feel grounded and be able to feel loved. So relaxation techniques, I think, are very helpful for providing grounding. There's a lot of these. Also, things like yoga and Tai Chi, I think, are fantastic. Things like heart math. We have heart math experts here are very helpful for using biofeedback to regulate the nervous system, which then regulates the cardiovascular system and slows things down, moves us more into a state of safety and acceptance and love. Mindfulness adds on top of that sort of an additional thing, which is this metacognitive capacity. So I think these are good programs. I mean, I think I don't want to sound like I'm hawking mindfulness, so to speak, but that's what I happen to study it, and I happen to do it, and I share it with patients. And we also find changes in the brain, structurally, more important, functionally. And the particular change in the brain that we see is sort of what's happening when you're doing nothing, right? When you're resting. So when I'm resting, normally what tends to happen is a lot of different thoughts pop up, and usually planning thoughts or worry thoughts. What do I got to do? Where am I going to go? What am I going to have for lunch? Blah, blah, blah. There's a sort of constant monologue, sometimes dialogue, as you answer yourself, that's going on that's sort of, it's not unconscious. So this is not sort of, as Dr. Stauber was saying, sort of unconscious, but it's just below the level of awareness. And so mindfulness meditation has the effect of being able to be a little bit more aware of that process. And so what it does is it tends to lead to a change or an increase in the connectivity between a brain system called the default mode system, which is the mind wandering or kind of hanging out and doing nothing, the internal monologue system, which tends to be central. It's for the ventral medial prefrontal cortex and the posterior cingulate, and the dorsolateral prefrontal cortex, and the areas involved in conscious control of volitional mood shifting and sort of resource allocation. So if you do, or I shouldn't say, can't promise, but on average, people who do several weeks of mindfulness meditation start to see a change in the interaction between these two brain systems, such that the executive control system starts to interact more with the mind wandering system. Is that what you're?
Yes, perfectly said. Yes, thank you. There's some evidence as well about genetic and epigenetic factors that contribute to resilience. Could you speak briefly about that?
Sure. So, I mean, genetically, I think we all recognize that things tend to run in families. We know that some families tend to be a little bit more anxious, for example. Some tend to be a little bit more easygoing. So I think in general, there is some evidence for a global and broad influence of our genetics, sort of on different aspects of the nervous system. And interestingly, I think there are, I've actually seen it. So I did a research study with Ohio National Guard veterans who were all deployed to Afghanistan or Iraq. We followed them up over several years, and people who had one particular form of a transmitter, so it's called the beta-2 adrenergic receptor, which we all recognize as from beta blockers, right? That we take to regulate high blood pressure. So if you have one particular form of this gene for that particular receptor, they tended to be less effective by childhood adversity, which is really interesting. Now, I 20 years ago, I was really super interested in genetics. I'll be honest, I'm a little bit less so now, because there's not a whole lot that we can do about that. We can't really change our genetics, right? We can, though, change a lot of the things in our environment, and we can change a lot of the ways that we think about things in our environment. So I do think that there probably is, but it's really diverse. I think there's a lot of different genetic factors that affect resilience in different ways. And I think that probably explains about 2% of the variance. So I'm probably more interested in the 98% of the variance, which we can do something about.
Just to add to that, I think that one thing that we can do though about genetics is we can know when things increase our risk. So just like in any other medical problem, if you have a family history of a type of cancer, you know that your risk is greater and you take more precautions or you get earlier screening. So similarly with mental health problems, both whether it's mood disorder, anxiety disorder, or any other medical or mental health problem, if you do have a family history, there is a potential genetic link. So it helps you to know, I might have more of a risk for this. So therefore I need to take more precautions. Maybe my whole family is anxious. Everybody has an anxiety disorder in my family. So maybe it's more important for me to practice things like relaxation, mindfulness, or other ways to decrease my anxiety in order to prevent a problem, which isn't, you can't always prevent these things, of course, but knowing your risk factors can really help give you that awareness of how to improve your health, both with medical health and mental health.
They're very well said. I really appreciate that. And what that triggered in me that I remembered is that, of course, serious mental illness, things like schizophrenia, have a huge amount of stigma and are very serious. What's interesting, and people with persons with schizophrenia in their family are at increased risk. Interestingly, though, it's very often not for psychotic disorders. It's very often for depression. And so recognizing that, families that do have affected people, being aware that there may be risk, and again, as also what Dr. Stauber was saying, finding ways to be smartly selfish, to be thoughtful about oneself, to really practice self-care, I think is huge.
And even just briefly to comment on some of the genetic predisposition to mental disorders. If you find yourself talking with a mental health care provider, like a psychiatrist or family doctor or psychiatric nurse practitioner or something, and you've had a family member who responded to one antidepressant, there's a good chance that could also be helpful for you. So, just to keep that in mind as well, to always give as much information as you can, because there's a chance that, like I said, if it was helpful for somebody else in your family, there's a potential that it could also be helpful for you to the same degree, or perhaps even more so.
Are there new technologies that are informing the science of resilience?
There are, in some of my readings, there are, some ongoing research in terms of different neurotransmitters and neuropeptides that play a role in commenting on, if someone's at more risk for developing a mental health disorder, and also to comment, on how robust they can be in terms of resilience. A lot of the research currently, and over the past decades, has commented on neurotransmitters like serotonin, norepinephrine, dopamine. There's gamma aminobutyric acid, and one that has, I think a little bit less research going on right now is called neuropeptide Y. And many of the medications that are available work on these, but there's ongoing research to determine whether or not medications perhaps to act on neuropeptide Y could be a benefit. Also with the beta adrenergic system as well. I mean, sometimes I will use a medication called propranolol to help out with one's anxiety. Sometimes whether or not it's trauma related or if it's related to more generalized anxiety. So, just to comment on that briefly, on what types of transmitters are potentially involved, and for the sake of what types of medications could be created for the future and why they're used currently.
I think one other huge piece of technology are these things. that we carry in our pocket, our tracking devices to allow the government to track us. It's a joke. But maybe not a joke. So I think that all the apps add to our stress quite a bit. And we know that. We know that Instagram is really harmful for adolescent girls and for others. And we know that Facebook is harmful in different ways. But there also, I think that there is some opportunity and potential for apps to be helpful. And like the HeartMath app, like other apps. There's something at University of Wisconsin called the Healthy Minds Project, which I think is a beautiful app. There's a lot of apps. There's actually so many apps out there, we can't count them. So we'll sort of see what happens. A lot of it is bogus too. So I think being smart, Calm and Headspace, I think both are pretty good. I think again they're kind of anodyne, meaning that they're not really harmful. I think they're helpful. The HeartMath is helpful, and I do think that different forms of technology, as well as wearable sensors. So the smartphone or the Fitbits and the Apple Watches and all these things. I think we're still it's still a bit of a Wild West, and we're still very much in the beginning. But I do think that these things will be common, and they'll be used to help, build, as Angela was saying, building the muscles of resilience. And technology can probably help.
So as we bottle resilience, so far we've got social support, self-care, mindfulness, exposing ourselves to nature, of course, physical activity, sleep and rest. There are many different forms of rest. There's a packet in your packet. There's a list that shows the different kinds of rest. So be sure to look at that. We also have mindfulness and gratitude and hope. How about volunteerism?
Hey, if you can do it, I think it's wonderful. If you got the time, if you got the ability, no, really, seriously. It can feel really good. But for those of us that I think are just overworked and overwhelmed, we need to volunteer for self-care.
It's a great point. Somebody mentioned too in our discussions about a feeling of you matter and belonging. So as we try to cultivate this feeling in ourselves and in our kids, do you feel like that's something important that we could focus on for building resilience in our community, in our families, in our offices? The feeling of you belong and you matter.
Yeah, I think this goes along well with perhaps self-gratitude, recognizing the effects that you have on others on just a daily basis. Sometimes for good and for worse. Even just reflecting on kind of my training, and when I was a resident doing psychotherapy for patients, sometimes I would question, am I really doing a whole lot for this patient right now? And is it really having like a good effect on them? And, I found that I was kind of downplaying the work I was doing for the people I was working with. And it can be helpful to kind of take a step back and see, they are benefiting, but perhaps it's more of a subtle thing. It's not quite always visible to the individual, but maybe more so to the people surrounding.
We are going to begin to close up. And as we do that, if there are any audience questions, let me know. I would take a couple now before we offer some last thoughts from panelists. Does anyone have any questions? This is your chance. They're not going to charge you. This is clinical help right here. Okay. So to each of you, what would you say to community leaders, parents, families? What is the single most important thing that we could be doing to build resilience? 3 words or less.
Be kind to one another.
Here.
Prioritize yourself.
Yeah, I'd say I have nothing to add. Self-care and kindness. So I think really, and nature. I will add one. That's a 3rd word. Getting outside of square perpendicularity. We spend our life, perpendicularity meaning these right angles. There's fascinating anthropological research. People who don't live in boxes, they see the world very differently. I live in a box. I like my box, but every so often you got to go outside the cage, Go free range, be a free range human.
Be a free range human, everyone. That's a quote. I want a t-shirt for that. Nature, self-care, and kindness. I think those are three beautiful sentiments to leave us with today. We are going to I'm going to review a few resources here that are in your question. Okay. Oh, we have a question. Will the practice upstairs accept teens for therapy? What's the age for the services upstairs provided by Ohio State?
I want to say that it's 17. It's not young, but I'm not quite sure the exact age.
I know Dr. Carpenter has says that they have made some exceptions for 15 or 16-year-olds in the practice. So there will be, just for the general knowledge, there will be about 15 to 16 Ohio State mental health practitioners moving into our building upstairs in January. So there will be tremendous resources coming into the Phillip Heights Center. So we're so excited for that. As we said, 2 of our panelists today will be moving upstairs, led by Dr. Kristen Carpenter. She's bringing the team in. She has said there will be a couple of people that can see, and they have made exceptions for younger adolescents, age 15, 16, 17, and so forth, where traditional adult wouldn't be 18, but they would potentially make some exceptions. We are also actively working with Nationwide Children's, who is also present in the building, to provide additional resources, because we know that that's a desperate community need for mental health for our kids. So we're actively working on that for sure. Thank you. For another question?
I have a question. So I'm curious if there's any pointers on how to start this kind of conversation, because I know that checking in with family and friends about mental and emotional wellness can be a sticky, hard, difficult subject. So I was curious if there were any, conversation starter ideas.
Well, this might be, I mean, it may not be for every case. For some cases, this might be sort of a silver lining of the shared adversity that we have. Many people don't want to talk about depression or anxiety, but everybody can recognize stress. And stress is not stigmatized. We all experience it. And we can maybe that might be one conversation starter. It's like, wow, like we're putting up with a lot right now. I noticed that you got a lot on your plate.
Just to echo that, sort of starting with your own vulnerability, kind of talking about how things are affecting you and what struggles you may or might be experiencing would be a way to start a conversation, to check in on other people as well.
I also think it's likely highly individualized. Like what kind of initial prompting statement could be helpful. It may be that, depending on the person, just asking something like, "Are you okay?" Perhaps they get that a lot. Perhaps it seems somewhat repetitive to them, and they are like, "Of course I'm okay. Why are you asking that?" So instead, it might be something like, "I noticed that you're no longer perhaps doing this activity that they used to like to do in the past. Are you still enjoying that? Or you're doing something else? Like, can you tell me more about that?" So in general, I think kind of an open-ended prompting statement could be your initial statement.
We are actually going to wrap up just about 5 minutes early. I have a few closing statements, but I do want to just provide 5 extra minutes in your day for everyone to follow the advice that these experts have provided us today, to get out in nature, to walk, to breathe. It doesn't have to be a big commitment, just simply taking 10 mindful steps, or even when you walk from your car to the grocery store, taking that opportunity to be mindful, taking some extra breaths and just enjoying nature around you. So as you leave here today, please keep this in mind and carry those thoughts with you. I will just reiterate, there are some resources in your packets, and we spoke about them today. Of course, the Healthy New Albany website, we have many programs: Tai Chi, yoga, urban Zen, nature walks, and so many different things that can contribute to this wellness that you're seeking. Of course, in Still Wellness, various healing modalities are offered there. They're just about a mile away, so please check them out. They have a wonderful website. Another wonderful local partner is the Wellbeing Connection. They do so much to support mental health in the community, particularly working with adolescents. Star, Dr. Yeager was actually supposed to be here today, and he is sadly on medical leave. So we wish him our best. We will have Star return again, but stress, trauma, and resiliency, there's a new clinic, part of OSU College of Medicine. That information is in your packet. They have tremendous resources there. You can also check our website out for additional mental health resources locally. I thank you so much for being here today. Our 2022 topics will be published in December, so we'll be back here every month, with the exception of a couple happy hours in the summer. We'll be back here monthly with various lunch and learns. So let's stay connected. If you have any thoughts or ideas about what you'd like to see here, please let me know. And otherwise, enjoy the rest of your day. Thank you.